Hi everyone, I'm Sarah, a sports therapy lecturer and your go-to guide for smashing your anatomy studies. If you're struggling to keep up or you want to speed up your learning, you're in the right place. Today I'm sharing 5 proven tips to help you learn anatomy faster and actually remember it. So my first tip is to use visual learning tools. Anatomy is all about structure, so use your eyes. Use diagrams, 3D models, apps like Complete Anatomy or Visible Body. These tools bring the muscles, bones, and joints to life. Now, if you're a sports therapy student, focus on functional anatomy, how structures move and work in action. Now, tip 2 is apply it practically. If you can feel it, you can learn it. So during other modules, so during massage or rehabilitation sessions, palpate the muscles as you revise. You can tape out muscle lines on a friend or a client, link the structure to its function, and use real injuries or assessments to really reinforce your learning. So tip 3 is to use active recall and spaced repetition. Don't just reread your lecture notes or the notes that you've made in class. Really test yourself. Whether you use flashcards, quizzes, sticky notes on mirrors, make sure that you understand and you can recall that anatomical information. Now, spaced repetition helps your brain move information into long-term memory. There are lots of free tools that you can use, like Quizlet, which is tailored to anatomy and to help you really test yourself on your knowledge. Now, tip number 4 is to teach it to someone else. If you can teach it, you really know it. Find a study buddy and explain what the rhomboids do or why sciatica might occur. This will also highlight your weak areas when you're trying to teach it or explain it to somebody else. Now, tip 5 is to make it make sense. Stop learning things in isolation. So lots of students will memorize origins and insertions. That is a lot of information for your brain to take in. So learn it as movements. What muscles do knee flexion? What muscles do knee extension? And once you understand that, then you can say, well, actually, this muscle's origin is this and this muscle's insertion is this. So learn it as a group movement instead of isolation. Also look at it, why does that matter in rehabilitation or sport? When you actually connect the theory to clinical practice, it will stick. So there you have it, 5 fast practical tips for mastering anatomy. If this has helped, give it a like, comment with your biggest anatomy struggle, and hit subscribe for more sports therapy content. Remember, it's not all about memorizing everything. It's about understanding it so you can use it.